Good morning to one and all. Today let us talk another one more topic under biochemistry, that is diabetes mellitus. In part 2, we are going to discuss regarding clinical manifestations, diagnostic findings and management. Here we can see what is the objectives of our presentation. So we have to define diabetes mellitus, we have to list out clinical manifestations, and we should know regarding assessment and diagnostic findings belongs to diabetes mellitus, and the management of diabetes mellitus. So what is diabetes mellitus? It's a group of metabolic disease characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. So in diabetes mellitus we should understand regarding it is a metabolic condition which is always characterized by hyperglycemia resulting from defect in insulin secretion, insulin action. Sometimes the pancreatic gland unable to secrete sufficient amount of insulin, and sometimes what will happen? The gland is producing insulin, but our body is not responding to receive that insulin, and sometimes the the defect may be occurring because of the both factors. Other definition we can discuss regarding diabetes mellitus. It's a group of metabolic disease characterized by elevated levels of glucose in the blood, that is known as hyperglycemia, resulting from defects in insulin secretion, insulin action, or both. So let us talk about regarding clinical manifestations. Clinical manifestations of all types of diabetes includes the three P's. So what do you mean by these three P's? Polyuria, polydipsia, and polyphasia. Polyuria, which means increased urination. The patient will go for frequent urination. And polydipsia, increased thirst. So patient continuously want to drink water. It occurs as a result of excess loss of fluid associated with osmotic diuresis. The patient also experiences polyphasia. This is the third P. So what do you mean by polyphasia? Increased appetite, which resulting from the catabolic state induced by insulin deficiency and the breakdown of proteins and fats. So let us see once again what do you mean by three P's? The three major symptoms of diabetes. These are polyuria, polydipsia, and polyphasia. So in the picture wise, you can see some of the symptoms. Always the person may be feeling tired, frequent urination, sudden weight loss, and wound that won't heal. Usually, as a complication, diabetic patient may be undergoing the diabetic foot or diabetic foot ulcer. In that cases, healing process may be delayed, and some kind of personal problems may be arising. Always feeling like hunger, blurred vision. So blurred vision, we know that clarity of the vision will be lacking, and numbness or tingling in hands or feet. So why it is happening here? Because of the nervous system or neuropathy. Neuropathy complication may be arising because of the diabetes. And always thirsty, patient will go for the thirsty. Then some reproductive organ problems also will be arising here. We can able to go through these are the common signs and symptoms a patient is suffering with the diabetes mellitus. Other symptoms which includes fatigue, weakness, sudden vision changes, tingling or numbness in hands or feet, dry skin, skin lesions or wounds that are slow to heal, and recurrent infections. What do you mean by recurrent? Frequently the person may developing the infections. The onset of type 1 diabetes may also be associated with sudden weight loss or nausea, vomiting, or abdominal pains if patient have developed DKA. What do you mean by DKA? Diabetic ketoacidosis. This is one of the complication. If patient is suffering with the diabetes, he may be having the complication of diabetic ketoacidosis. So let us talk about regarding assessment and diagnostic findings. An abnormal high blood glucose level is a basic criterion for the diabetes diagnosis. The first investigation is fasting plasma glucose. So the level should be managed in the range 126 milligram per deciliter or 7.0 millimole per liter, or more, or random plasma glucose exceeding 200 milligram per deciliter. So that may be 11.1 millimole per liter on more than one occasion or diagnostic of diabetes. So another investigation, the oral glucose tolerance test and the intravenous glucose tolerance test are available but are no longer recommended for routine clinical use. In addition to the assessment and diagnostic evaluation performed to diagnose diabetes, ongoing specialized assessment of patient with known diabetes and evaluation for complication in patient with newly diagnosed diabetes are important components of care. So let us talk about regarding management. What is the management? Preferable management for diabetes mellitus. The main goal of diabetes treatment is to normalize insulin activity. We have to, whatever management we are providing to the diabetic patient, what is the main goal here? Insulin activity and blood glucose levels to reduce the development of vascular and neuropathic complications. The main goal of the diabetes treatment is to normalize insulin activity and blood glucose levels to reduce the development of vascular and neuropathic complications. And the trial investigated the importance of intensive glucose control on the development and progression of complication as retinopathy, nephropathy, and neuropathy. If you are not controlling properly the diabetes status of the patient, he may be developing some of the complications. What kind of complications? Retinopathy, nephropathy, and neuropathy. Then, careful screening of patients is a key step in initiating intensive therapy. Therefore, the therapeutic goal for diabetes management is to achieve normal blood glucose level. So, if the patient is able to manage his diabetes properly, that is known as euglycemia. Euglycemia means patient is able to manage his blood glucose level in the normal ranges without hypoglycemia and without seriously disrupting the patient usual lifestyle and activity. There are five components of diabetes management. So what are the five components? Nutritional management, exercise, monitoring patient glucose levels, then pharmacological therapy, then finally education. The first component is nutritional management. Nutrition, diet, and weight control are the foundation of diabetes management. The most important objective in the dietary and nutritional management of diabetes is to control of total calorie intake to attain or maintain a reasonable body weight and control of blood glucose level. Providing all the essential food constituents, for example, vitamins, minerals, are necessary for optimal nutrition, meeting energy needs, achieving and maintaining a reasonable weight, preventing wide daily fluctuations in blood glucose levels, with blood glucose levels as close to normal as is safe and practical to prevent or reduce the risk of complications. Decreasing serum lipid levels, if elevated, to reduce the risk for macrovascular disease. Caloric requirements. Calorie control diets are planned by first calculating the individual energy needs, like BMI we have to notify always, and calorie requirements based on the patient age, gender, height, and weight. An activity element is then factored in to provide the actual number of calories required for weight maintenance. To promote a 1 to 2 pound weight loss per week, 500 to 1000 calories are subtracted from the daily total. The calories are distributed into carbohydrates, proteins, and fats, and a meal plan is developed. Monitoring glucose levels, and ketones. So, blood glucose monitoring is a cornerstone of diabetes management and self monitoring of blood glucose, that is known as SMBG. These levels by patient has dramatically altered diabetes care. Frequent SMBG enables people with diabetes to adjust the treatment regimen to obtain optimal blood glucose control. This allows for detection and prevention of hypoglycemia and hyperglycemia and plays a crucial role in normalizing blood glucose levels, which in turn may reduce the risk of long term diabetic complications. The another investigation we have to talk about regarding glycated or glycosylated hemoglobin. So, what do you mean by this glycosylated hemoglobin, which refers to a HbA1c or A1c, is a blood test that reflects average blood glucose levels over a period of approximately 2 to 3 months. When blood glucose levels are elevated, glucose molecules attach to hemoglobin in the red blood cells. So, what is the concept of here? The normal average lifespan of RBC 120 days. So, this investigation we can notify how well the patient was controlling his status. The longer the amount of glucose in the blood remains above normal, the more glucose binds to the red blood cells and the higher the glycosylated hemoglobin level. This complex, the hemoglobin attached to the glucose, is permanent and lasts for life of the red blood cell approximately 120 days. The normal values differ slightly from test to test and laboratory to laboratory, and normal ranges from 4% to 6%. So another investigation they can have to be performing like urine testing for glucose. Testing for ketones. So ketones are ketone bodies in the urine's signal that control of type 1 diabetes is deteriorating and the risk of DKA is high. What do you mean by DKA? We already discussed regarding diabetic ketoacidosis. When there is almost no effective insulin available, the body start to break down stored fat for energy. Ketone bodies are byproducts of this fat breakdown and they accumulate in the blood and urine. So, what is a pharmacology therapy for diabetes mellitus? Insulin therapy or and insulin preparations. So now we can see pharmacologically there are different kind of time course was given here. The availability of the insulin may be considered the rapid acting, short acting, intermediate acting, long acting, and very long acting. Here we can see onset. It is start work from the 10 to 15 minutes. That's why the name is given as a rapid acting. Another one is 10 to 15 minutes. Then short acting is meaning is it may be working from the start to work from the half an hour to 1 hour. And intermediate 2 to 4 hours or 3 to 4 hours. And long acting 6 to 8 hours. And very long acting 1 hour. So we can see here some of the agents also. So these agents may be differ from hospital to hospital or according to the availability to the hospital. So what are the complications due to insulin therapy? So sometimes maybe notifying as a local allergic reactions. Local allergic reactions like redness, swelling, tenderness, and induration, or a 2 to 4 centimeter wheal may appear at the injection site 1 to 2 hours after the insulin administration. Systemic allergic reactions to insulin are sometimes rare. When they do occur, there is an immediate local skin reaction that gradually spreads into generalized urticarial. Then lipodystrophy. Insulin lipodystrophy refers to a localized reaction. So how we can deliver the insulin to the patient? Maybe injections can be given to the subcutaneously. Sometime the longer period the patient require insulin therapy in ICU setting or in the hospital management, we may use the infusion pump. So large quantity we can give uh, in the manner of minimal therapy like zero point 0.1 ml, zero point 0.2 ml, such kind of, or if we require large quantity, we may use the infusion pump, like a drip method we can use. If we are using like a minute quantity, for example, 24 hours the patient under monitoring of glucose therapy, we have to give here 0.1 ml, 0.2 ml, 0.3 ml minimal quantity to little bit higher quantity of the drug therapy can be delivered with the manner of syringe pump. Then insulin resistance. Most patients at one time or another have some degree of insulin resistance. Alternative methods of insulin delivery are insulin pumps, uh, let us see. Continuous subcutaneous insulin infusion involves the use of small externally worn devices that closely mimic the functioning of the normal pancreas. Some other methods we can notify here: implantable or inhalant insulin delivery. The other one is transplantation of pancreatic cells. Here we can see different pictures was given here, in that how the patient was taking self insulin injection by using of the pen insulin. And another one we notified here, implantable device. This implantable device will be attached in the attached in the dermis, so that the medicine will be absorbing by that device to the skin slowly. Then finally, let us talk regarding management. Educate about home glucose monitoring. The patient want to monitor his blood glucose level at home regularly and review factors in glucose instability. If the glucose fluctuation is there, we have to be notified and discuss how the client anti-diabetic medications are working and check viability of insulin. Review type of insulin used. Check injection sites periodically, maybe to notify the lipodystrophy. The nursing diagnosis, you have to follow the Nanda nursing diagnosis. Risk for unstable blood glucose level may be related to insulin resistance, impaired insulin secretion, and destruction of beta cells. And risk for infection related to delayed healing of open wounds, deficient knowledge related to unfamiliarity with information, lack of recall, or misinterpretation. Risk for disturbed sensory perception related to endogenous chemical alteration, impaired skin integrity related to delayed wound healing, ineffective peripheral tissue perfusion related to too much glucose in the bloodstream. Let's summarize our topic. Let's recapitalize the topic of the diabetes. Clinical manifestation we have discussed. The main clinical manifestations of diabetes mellitus are polyuria, polydipsia, polyphasia. And what is the other assessment diagnostic findings? We have to confirm with the fasting plasma glucose, oral glucose tolerance test. And under the management, we have discussed regarding the calorie requirements, monitoring blood glucose levels and ketones, glycosylated hemoglobin, testing for ketones, pharmacological therapy, complications of insulin therapy. So what kind of complications? Retinopathy, nephropathy, neuropathy are the more complication we will be notifying. And nursing management, we have to be monitoring the patient how well he is controlling his blood glucose level in the manner of glucose testing. And we have to formulate the, being a nursing students, we need to formulate the nursing diagnosis. I hope it is, though it is covered under the biochemistry, but when you are studying medical surgical nursing, you have to follow the sequence of the diabetes condition in this manner. So I hope so that you understood this topic well. Once again, we'll meet. Have a nice day. Thank you, one and all.